Hello, Dying Your Way podcast listeners. I'm so happy to be with you today and to introduce our very special guest, Michelle Lasota. She is a hospice and oncology nurse and has a bit of fame in the positive death movement world because she is the nurse that is featured in the documentary, The Nurse with the Purple Hair, by filmmaker Sean Cunningham. And I'll introduce you to Michelle, and you'll get a chance to hear more about that amazing film. But she is just someone with the biggest heart, the biggest smile, and has the ability to just take a very sad and chaotic situation and just shine light on it. And you're going to love her. And now I'm going to introduce my listeners to Michelle Lasota. Hi, Michelle. It's so wonderful to have you here and that you still have purple hair.
Thank you so much for having me. It's exciting to be here. And yes, I very much have purple hair.
Yeah, and I got the purple shirt just to honor you. So
very exciting. Can never have too much purple.
Yeah, so you're in Philadelphia. We're here in Western Australia, so it's late for you, and I'm just now getting up. But yeah, I'm just so honored to have you here with us today. Thank you so much.
Likewise, thank you.
So the sound is still going in and out a little bit. So let's see. Tell us a little bit about how you met Sean Cunningham, who is the director of all of the Friday the 13th movies, and kind of famous in the horror genre as a director. And how did he find you and want to? How did you guys connect?
Well, horror is one of my favorite genre of movies, and other than nursing, I'm a bit of a movie nerd. So I started to work at film conventions, pardon me. And I then became a celebrity assistant. And so Sean and I were paired together at a convention in Toronto. And I was thrilled to meet him. But within minutes of our first introductions, he just sort of casually asked me, what did I do for my day job? And I told him that I was a hospice nurse. And there was an immediate emotional response to that. And I quickly learned that there was a very recent loss in their family. And so that sort of opened up this doorway for us to engage in these conversations about end of life. And he said to me, a little later, I'd like to pick your brain if you don't mind. And I said, well, sure. And so, as the weekend ensued, we just began to share stories back and forth. And he asked me about what I did. And, I just really couldn't help myself with sharing why I do what I do and how it's not all sad. And there's this beauty in it. And that, like you said, someone should be shining a light on it because, it's hard. I know there were so many days where I'd be at work and I told Sean, I struggled to find a way to really engage people in helping them understand what it was that hospice does and not to be afraid of it and sort of debunk the myths, and sort of bring light to the truths about it. And so we just sort of, we hit it off and we just didn't stop talking. And, he really became a really just wonderful advocate for all things end of life. And, he had shared with me his experiences prior to that loss. And I said to him, man, I would love to have a camera follow me around. There's been so many television shows on that don't really explain what real death looks like in a variety of settings. And unfortunately, sometimes that's sort of what we associate it to be, is what we see.
Yeah.
And so he reached out to me not long after that. And he said, I haven't been able to stop thinking about what you said. And I think you're right. I think people need to know. What do you say we make a movie together? And the rest was kind of history. It became this beautiful marriage of both of our passions.
And it is something that people can get on Amazon Prime right now, right?
They can find it on Prime, or they can go find it on the website as well.
Well, so I was introduced to the documentary. I was in New York City for an international end-of-life doula seminar that was happening over the weekend. And I think the way they just sort of brought us all together at the very beginning of this 3-day event was to watch your movie. And, you got to have boxes of tissues around. I mean, you're laughing, you're crying, and it was just so heart opening, and it just set the tone for this is who we are. This is what we do. This is what is an example of how we want to be. So it was certainly affected me that way. And I'm sure it did everybody else that was, all over to see that. And, then when I came to Australia, I actually brought the DVD with me because I was just like, I purchased the DVD and I was just like, yeah, you never know. You never know. And I'm involved with the Bustleton Hospice and doing some educational type work with them. And so I was speaking to their volunteers and I showed them your movie. And it was just, again, the tissues, but it opened up a conversation that was, yeah, I mean, they're well-trained hospice volunteers and they're all kind of, part of our same choir, but it just opened up the conversation at a much deeper level about why we do this work. And, the way Sean Cunningham captured what it is that you do, that we do, really, I hope everybody that's listening will take the time to watch that documentary because it's so wonderful.
Oh, thank you so much. And honestly, it's an honor to, have been a part of that because I feel like it's sort of, like you said, it represents all of us. It's not really my documentary, it's our documentary. It's where it does exactly what you said. And there's just, it's so hard to explain what an honor it is to stand in that precious space with people, to be invited into their story, because that's what we are. We become characters in their story. And it's really just an honor to be there and watch it unfold and help make it wonderful.
You had a very special relationship in that documentary with Frank, who I loved how you you captured him and his wry sense of humor. But what really touched me about Frank, I have a theater background as well, a musical comedy background and a ballet background, but to see this person in the prime of his life and that you were able to put the focus on who this person was as a person and his humanity and his accomplishments, and that was what is, and that what was interesting is how he really didn't value that as much as you valued that. And you shine the light for him on him.
Yeah, Frank is someone who will always be with me. He's a piece of Frank is with me every day. I sort of think of him as my foundation into hospice, if you will. And, he just became my friend, and I his. But yeah, he was extremely cantankerous. And I loved that about him. I loved that he sort of gave me a challenge. Yeah. And then we sort of, our wittiness kind of tossed back and forth. And that's what I think, made us work together. Everything wasn't so serious, and we could sort of dig in here and there and use our sarcasm to kind of get through the hard stuff. But yeah, Frank, he sort of closed himself off to, letting the world know how amazing he was, because there were different parts of his life that, unfortunately, I think sort of turned him inward from that, boy, when I discovered who he was and what he'd done and just all the different layers, it was so exciting and it was so fascinating. And just honestly, it was really amazing. Frank had done so many wonderful things.
Yeah.
But yeah, he was always just sort of like, okay, he was very just dramatic about everything. And I loved it, And for those of you who haven't seen the film, there's this, there's a part in it where we discuss Frank's professional career, and he sends me upstairs to get this brown paper bag full of these beautiful headshots. And I still have one. I have one hanging in my dining room, and we went through all of it. And I said, Frank, I can't believe you have all these things, like in this bag on the floor upstairs. What is happening? This needs to be on the wall. It needs to be in a book. And he was like, what am I going to do with that? And I said, oh my God, I would love to have something like this. And he said, well, take what you want. And I said, well, only if you autograph it. And
Oh,
so we just had such a wonderful day that day.
yeah.
But the beautiful thing about Frank's story, as far as, enveloping hospice and the community, is that door opened, and slowly he allowed each member of the team to come into his story and, take their place. And Frank also utilized all of the different dimensions of hospice. There are different levels of care that are offered in hospice that people don't, they don't know about off the cuff. We have to talk about that.
Yeah.
There's routine level of care, respite care, continuous care, inpatient care. And there were different points in Frank's journey. I mean, there were even points where Frank revoked hospice, where he sort of hit a plateau, and, his criteria level changed on his eligibility. And then he was admitted again. He reaccepted the service.
Yeah.
And so there's so much to Frank's story that is really beneficial when trying to explain the full spectrum of what hospice really encompasses.
Yeah, people don't know. People don't know what a resource and all the benefits and the bells and the whistles. And one of the things that I wanted to talk to you about or ask you about is my experience with hospice was through my early on was with my parents. And evidently the criteria changed or something changed. My mother had Alzheimer's, and she was on hospice for 6 years continuously. And my father was in and out on hospice for 2.5 years. And I mean, you could argue about, when you get a life-threatening diagnosis, yeah, let's get palliative care in there and support that. But when did it change, and why did it change? Because now you can only do it, 6 months, and then it's a year? Or how has hospice changed since you've been a hospice nurse is my question.
So as far as regulation, with what I'm familiar with, when someone has been diagnosed with a terminal illness, their physician, has to determine that if their diagnosis or disease process were to follow its natural course of progression, that it's rational to believe that they could pass away within 6 months or less. That does not mean that they have to pass away, as in, you just gave two different examples. So initially, people are certified for a 90-day period. And so after that first 90 days, they're reevaluated then again by the physician and or nurse practitioner, and they're recertified for an additional 90 days. And then after that, they're recertified for an unlimited amount of 60-day certification periods. And so what that means is when the doctor's reevaluating them, they're saying, yes, we still have this diagnosis, things are, progressing, or the management of the disease that we're providing, is sustaining someone's life in a symptom management way. So we're not trying to cure the disease. Right. We're trying to manage, how does that disease make you feel? Yeah. However, within the confines of that, it is likely that your life could end, because of this disease within this time frame. But because we don't know that, we can't put a hard deadline on that. Now, different disease processes have additional criteria based on Medicare guidelines. Right. So for instance, Alzheimer's, like you mentioned, or COPD, or heart disease, or I'm sorry, I was saying heart disease or lung disease, or, our chronic illnesses. So those things have different criteria when the physician is reevaluating or certifying someone as eligible to receive those services. And I stress that because hospice is not something that someone puts you on. I want to be very clear that is, it is a benefit that you are offered. And it is something that you elect, which means you choose it for yourself once you're told you are eligible for that service. So that's a very important piece to understand.
Yeah, people don't necessarily know to ask for a hospice referral. It may not be right or wrong. I mean, who knows if they would be accepted or not, but getting those early referrals, I've found, really helps to the patient and their families to kind of get a realistic picture about where they are, because now they are stricter about meeting that criteria than I think they were when my parents were on hospice.
And that is sort of evolving all the time, right, with medicine as it does. And I think it's important to mention that there is a difference between hospice and palliative care. So the way I like to say that is, yeah, so not all palliative care is hospice, but all hospice is inclusive of palliative care. So palliative care is management of symptoms. And so that should really be offered anytime there is a serious illness, right? Because anytime there is a serious illness, there are symptoms that make you not feel well. Mm-hmm. And palliative care, it's sort of like a layer cake. You have your primary care team, and then the palliative care team is an extra layer on top of that team that specializes in the symptom management portion of different diseases. So it's sort of like, a supercharged care team, if you will. And so it's not taking things away, it's adding to.
Right. So tell us about, because you talked about early palliative care and the need for that. And I know that you're with a group called Legacy of Hope, which I assume it's part of a oncology practice that you work with, and that they are providing those types of palliative care services to oncology patients that maybe are not in a terminal condition yet. Is that correct?
So Legacy of Hope is a separate organization. That's a nonprofit organization that is helping support cancer patients in Philadelphia to deal with a lot of the financial toxicities and a lot of the sort of everyday things that make it difficult to navigate a serious illness. So they're not the palliative care team. They're separate from the palliative care team. That's another additional layer, of support separate. But they work, to provide financial support and stability for patients who are going through cancer diagnosis. We have a grocery delivery program where they're bringing patients, fresh groceries who can't get out to the market. It was especially important during the pandemic when things were very difficult to find and people were terrified to leave their homes. And oncology patients, especially because they're immunocompromised patients. So they're, much higher susceptibility to infection.
Yeah.
And we had dietitians working to make sure that they were getting the nutritious foods that would help them best, navigate their disease process. So a little bit different, not palliative care, but again, another layer of support to those particular patient population.
Yeah, that kind of social work should be part of every palliative care team. The social workers. I mean, there are just too many situations where people need that extra layer. And talk more about financial toxicity, because tell us about that.
I think, every insurance is different. There are limitations to, what every insurance provides. And there seems to be high out-of-pocket costs for cancer patients or patients really who have chronic diseases or other chronic diseases that certainly, weigh a burden on that. There's, you have to think about transportation costs to and from many different appointments. There's copays on medications, and some of the medications, only portions of them are covered by insurance. So, our social workers work very hard to find different programs to sort of supplement and offset the cost of those high copays. But something that, if you are the sole provider or the primary provider of your house and you suddenly, have an illness that really sort of takes you out, and renders you unable to work, where does that really leave everything, right? And where does that leave, there's the medical cost, but then there's the cost of living. There's that sort of snowball effect happens relatively quickly. And so that's sort of where the financial toxicity piece comes in, when you have a serious illness in a home. I remember I had a friend once tell me, we were just sort of talking about, navigating these illnesses and being caretakers. And he said to me, if you think about it, we're all really 3 paychecks away from being homeless. Mm-hmm. And I never forgot that, because it's a really powerful statement. And I thought to myself, gosh, where would I be if I suddenly was without 3 paychecks?
Yeah.
I mean, we don't really think about that when we're in our daily routine, but when illness sort of sneaks in, because it doesn't care where we are, it doesn't care what responsibilities we have and how we're going to pay for things and do things, and if or when we can get back to work. What if we, as a result of our illness, or we lose our job? I mean, there's and right. We can continue to talk about all these things, but it happens very quickly. Those hardships are very real. They're very serious, and they need a lot of attention. And so
Well,
it's coming to the forefront.
so with the patients that you have worked with over your career, how many of them have family support or have a friend or a family or a primary caregiver to help them, an adult child or a spouse? How many people do you work with that don't have anybody in their support team?
It's a very mixed bag. I think I've seen the good and bad sides of both of those, or all of those scenarios, and to no fault of anybody. That's just, everybody's story is different. Things have happened differently in every person's life. And yes, there are situations that make it, sometimes feel near impossible, right, to navigate.
I was anecdotally, I was with someone that I was working with in a surgery that they had. And while the doctor came in after the surgery and was giving sort of the outpatient instructions, and I was talking to the doctor, and I said, so how many of the patients that you have, I'm just curious, have someone here with them to listen to these outpatient instructions and to take them home? And he was like, about 50%. And I was just in shock, and it just really made me realize that there is a huge population of people that aren't planning for their death ahead of time and don't have the most basic, whether it's 3 paychecks or 3 friends,
Yeah.
those things are so important to think about ahead of time.
Absolutely. And, I think it's important to mention that when there's a significant illness, that is really, that's really a family experience. It's not just one person. I mean, I tell people all the time, like, when you come to the hospital for anything, there's never, I mean, I've never had an experience where only one person took care of me the whole way from start to finish.
Right.
There is literally a team of people at every checkpoint along the way, right?
Yeah.
And so I tell people all the time, it takes a whole team of us to take care of one of you.
Right.
How could we ever expect you to take care of everything on the times that our absence is there?
Yeah.
It's not feasible. So it is very much a family and friend experience.
Yeah. Well, and that's where an end-of-life doula comes in and really supports those gaps and identifying those transitions before they happen, and see if there's a need for social services. It's very different here in Australia because they have community nursing, and they have, pretty much free health care. And, it's just very different than how it is in the United States, which we know has improvements that can be made.
Yes, for certain. Lots of improvements.
So if you were going to go before Congress, or if you were going to tell people how to do death differently, what would you ask them to do?
Wow, that's a big ask.
Yeah.
I mean, I think that, we need more people talking about it publicly, right? I think one of the biggest things is that we need to reframe how we look at death, how we think about death, and how we talk about death, right? So death is not a failure, yet we sort of teach it to be so until we get into this chapter. And, it's sometimes even surprising in the clinical world, right? And so I think we really need to start there by changing and reframing how we look at this, so that we sort of debunk and demystify it and take the fear away. I think it's not death that's a failure. Death is a guaranteed part of life, but people who are dying poorly without proper symptom management, that is a failure. I mean, medicine is, very advanced. It's changing all the time. And I think one of the things that's really important is that, yes, it's wonderful that we have all of this technology and all of these resources, but because medicine is advancing, we're able to keep people alive longer, but in turn, we're now dying slower.
Yeah.
And so the complexities of keeping someone alive longer does not become any less complex when we talk about the dying portion of that journey.
Yeah. Yeah. So there's, a lot of talk now about racial justice, but I would say there's also medical justice, that I am really aware that, having access to someone like you is not something that everyone gets, or, how do you find access to more Michelle Lesotos?
Well, thank you. That's quite an honor. And I agree with you. I mean, I think that there's so many of us who are sort of, you, myself, there's just so many of our death positive friends are out there, and we're all sort of waving these big white flags, and it would be lovely if we could just sew them together into a giant quilt, right? And just say, please look at us. We're all here we are. This is not something that is about me. This is something that is about all of us, right? This is a human experience. That's what this is.
Yeah.
And we really need to, what talking about death and planning for death does is it gives you back control of a very uncontrollable situation. And I think the things that we fear are what we don't know, and listen, we could plan and something sudden can happen and that could be out of our control. But, even the pieces that you were able to put down and talk about with family, it's a gift. It's something that you're giving to yourself, to your loved ones. It's not something that, they won't have to think, I think this is what mom would have wanted. I know this is what mom wanted because she told us. There's a piece in that for the people who are left behind, right? Because we know it's sort of like the final gift, right? It's the final gift that we can give is,
how do you learn how do you learn how to die if you haven't seen death? It's like the gift that we give is dying and letting people see a good way to die and what needs to be in place.
And to be quite honest, everything that's wrapped up in this, we're talking, we're using the D word a lot, right? Like that's like a no. But when we really sort of, like I was saying earlier, debunk it, demystify it, take the fear out of it, what we're really actually talking about under that, that scary word is, how do we want to live? Right? Because this is really about living, right? This is about living while dying. And to be quite honest, we're all dying every day, right? We've been dying every day since the day we sort of got here.
Yeah.
That's, so this is really, how do we want to live? That's what we're telling people. How do we want to live until we die? And, in medicine, not, I think, sort of just by default, if you will, people start to become identified by their disease. And I try to explain when I have someone shadowing me or I'm teaching a student that, I like to remind myself that in every sick body is a healthy person. And, what makes it less scary and what makes what I think I do really, I honestly want to use the word cool. I think it's really cool. I would say I have one of the coolest jobs. I get to meet amazing people that I would not normally cross paths with. They're all doing a wonderful life review. They're giving amazing advice, and they have the best stories ever, right? Because what I had learned to do was fall in love with the people, and nobody wants to be defined by their disease. No one wakes up and says, like, I couldn't wait to be sick. Like, I couldn't wait to get cancer. And did you know that it came with complementary pain and suffering? No one says that. It's so silly, right? Like, who says that? So just, we just have to remember that there are people in there. There's always people in there. And just sort of holding space, taking a step back. I like to say that people don't care how much you know until they know how much you care. And so that's what makes this work.
I love that you're talking about that because it's so important to see the person, and even after the person has passed, my mother was donated her body to science, and she died at home and the family was there. And, after we bathed and dressed her and everything, and, waited quite a while before we called the funeral home to come get her, to take her to the airport, to take her to a university in Florida where she was going, and she was dressed so beautifully. And I just was obsessed at the last minute that anybody that was going to be undressing her, I wanted them to know who she was. And so it's like I just quickly wrote out this bio because she was like a published poet. She was like, had all of these just, she had an incredible life too. And I wanted them to know before they put a knife to her who this woman was. So yes, when they're alive, how you can see their humanity and not their disease. But for me as a family member, it was really important to me that the people that were honoring, were learning from, working on her body, knew what an amazing person that she was.
That's really wonderful. And you know what's really cool about that is that you may not get to know the ripple effect of that, but I guarantee you that there was one.
Oh,
I mean, I guarantee it that you changed the course of that for someone and maybe for many. And that's so beautiful.
I never thought of that.
There's
Thank you.
there are these, I like to think there's something different we can learn from every person, right? So that whomever that team was that received your mom learned so much because you taught them about her through your beautiful story.
Yeah.
And those are the things that they're going to carry with them. And that may have been one team of doctors that were learning from her, and there may have been a room of doctors learning from others. And that team might have been just extra special. They
Yeah.
might have walked around totally differently because they knew that story,
Yeah.
and those pieces we take with it. Like, don't think they don't carry that with them. I'll tell you a secret, before, even tonight, before we got on this podcast, I thought to myself, I had a patient before who was in hospice. Her name was Myrna, and she had a stroke, and she was dying. And I met her and we had a lovely visit. And before I left, she said to me, honey, you look good, but you could use a little lipstick. And I chuckled. And her family told me she loved lipstick. She never went anywhere without lipstick. She thought every woman should have lipstick on all the time. And so I look in the mirror now, I looked in the mirror tonight and I thought, you know what? You look good, honey, but you can use a little lipstick.
Oh, I love that. I love that. Yeah. And I love what you say about the ripple effect because, we all have that. I mean, everyone listening, we all have that effect on everyone's life, without even thinking about it. You're such a lovely person, Michelle. I mean, I could just talk to you forever. I really appreciate you taking the time to, to be with our audience because they're very special people too. And if you haven't seen the documentary, The Nurse with the Purple Hair, you must get it. If you have Amazon Prime, look at it, or you can buy it. It's just so wonderful. Michelle, how are you going to be doing the next part of your career? I really want to know how.
So I'm currently back in school and I am pursuing my master's degree in nurse practitioner. So I hope to sort of level up, if you will, and continue on my journey in palliative care. And I really, really enjoy being a death positive advocate. I really love being a spokesperson, and I'm always looking for a way to learn more.
Yeah.
I mean, we're never done learning. And so that part is so exciting, and so any opportunity I have to talk with people like you, it's amazing, right? I mean, when we find our people, we find our people. And I think there's something magical when that energy comes together, right? It's just really special.
Yeah. And if people wanted to reach out to you, would Facebook be a good way for them to do that? Or
I'm very easy to find. I'm very accessible. I'm on Twitter and Instagram. It's Purple Hair Nurse. My email is purplehairnurse@yahoo.com. You can certainly find us on Facebook, and the website is
Yeah.
www.thenursewiththepurplehair.com.
Michelle, thank you so much for being with us tonight. You're tonight, my today. I just love meeting you. Like you say, when you find your people, it just is so uplifting, and just want to
So
thank
much.
you.
Yeah, likewise, it's been lovely.
Yeah. Well, we'll talk again soon, I hope.